Hello, my name is Swapna Kakani, and I'm with the Alabama Department of Public Health Office of Telehealth. Welcome to our Telehealth CART 101 training. This is a basic training to learn how to operate the CART to do telemedicine visits, telehealth visits, and video conferencing. In this training, you will learn how to turn on the CART, how to set up the camera, how to make a call to the distant provider, how to use the stethoscope, how to use the handheld camera, how to complete the patient survey and telehealth log, and finally, how to turn off the CART. Before we begin, there are some terms to know. VC, which means video conferencing, is when the CART is used for video conferencing for occasions such as staff training, in-service meetings, and external partners' use of the clinic room or telehealth equipment for non-clinical reasons. TH means telehealth, counseling, and interview encounter. This is used for non-clinical encounters with the client, such as social work visits, a diabetes educator visit, or disease intervention specialist visits. And finally, TM, which means telemedicine. This is a physician-patient or medical care provider encounter. This is with clinical staff and the client. There are 3 things you should remember before turning on the CART. The first is to make sure the CART is plugged into the nearest outlet, like so. Second, to make sure that the Ethernet cord coming out of the back of the CART is plugged in to the Ethernet jack. Third is to make sure that the charging cradle for this camera is plugged in to the power strip on the back of the CART, like so. And now we are ready to turn on the CART. To turn on the CART, you press the red power button, switch it on, and it's located on the power strip at the bottom. Once you have turned on the CART should turn on automatically. While it is booting up, take time to pull out your keyboard, pull out your mouse tray, and get ready. The top monitor and the bottom monitor will turn on. In some cases, the bottom monitor does not automatically turn on. If that is the case, please take your black remote and turn it on by using the red power button. There's also a power button on the bottom back right of this monitor. Another thing to note is that sometimes when you turn on the CART, the top monitor looks like the bottom monitor, as you can see. However, this should not happen. To correct this, you take your silver remote, point it towards the bottom monitor, press the up arrow, and you will see 2 icons, stop sharing and call. Press the enter button to select stop sharing. Like so. This is how the 2 monitors should look like before beginning. And now you're ready to log on to the computer. Follow the instructions on the top monitor, Control-Alt-Delete to log on, and use the username and password on the screen. Remember that the cases are sensitive. The CART is now ready to be used. We are now ready to learn how to set up the video conferencing camera located right here. First, take your silver remote and we're going to go over the controls. This silver remote controls the video camera using the lower monitor. On the top, you have a plus minus, which is your zoom in, zoom out. Then you have a gray dial with up, down, right, left arrows and a center enter button. Then you have a back arrow button, a mute, unmute button, a green call button, and a red end button. And this is your keypad. To begin the control of the video conferencing camera, take your silver remote and point it towards the bottom monitor and press the up arrow on the gray dial. You will see the selection icon went to a video camera on the top right of the monitor. Press the middle enter button, and you will see that the video camera is now on a patient. This video view is what the distant provider is seeing. So they will see you, your patient, and the clinic setting. So it is very important to create an optimal view using this as your guide for the distant provider. So in order to create that optimal view, you press enter, the middle button on the gray dial, to select that video icon. And now you see controls, your up and down arrow, your right and left arrow, and the positive and minus. This is mimicking your remote. If you can press the up arrow, down arrow, right and left arrow using the remote to change the view of the camera, like so. It is important to have the patient as center view. Do not create a lot of white space on top, like so, or a lot of white space on the bottom, like so. You can zoom out pressing the minus button on the remote, and zoom in pressing the positive button on the remote. Again, do what you need to center the patient into the view. Another way to control the angle of the video camera is to press the white lever located on the front right of the cart, press it up, and push the cart down, and pull the cart up. To get out of the video camera view, you press the back button on the remote. Press it once and then press it twice. And now you're back to the original view of the top and bottom monitor. You now know how to control the video conferencing camera. Now we are going to learn how to operate the stethoscope and handheld camera. You take your mouse and click on the stethoscope icon on the desktop computer on the top monitor. It is labeled stethoscope. Double-click it. A login screen comes up immediately. Your username is ADPH1 through 8. You can use any number between 1 and 8. If a number does not work, use another number. That means it has previously been taken. Your password is password 1 exclamation. This information is on your screen. Remember, cases are sensitive. Now, turn on the stethoscope by pressing the power button on the head of the stethoscope. Once the screen turns on, come to the computer, take your mouse, come to the My Stethoscope drop-down menu, and choose your stethoscope. It will be labeled with your county health department name. And once you click it, the instructions pop up. Follow the instructions and press the M for connect. Press it twice. And the green check mark should appear to indicate that you are connected. Then click Host a Session, and you will then get a session ID. Give the session ID to the distant provider. That allows them to connect with you. The provider will then guide you on how to use the stethoscope for the patient appointment. Once you're done, click Log Out or End Session, click Log Out, and power down the stethoscope by pressing the power button. And exit the screen. We're now going to operate the handheld camera. Take the handheld camera out from the charging cradle behind the monitor. Take the cord that is located in the back basket of your cart and connect it to the bottom of your camera. The camera is now connected to the telehealth cart. Then turn on the handheld camera by holding down the power button on the top of the camera for a couple minutes until you see the screen turn on. The camera must be turned on before you start the application on the computer. Now that the camera is turned on, click on the Horace UVC view icon on the computer, double click it, and you will now see that the view of the camera is on the display. To share this view with the distant provider, take your silver remote, point it towards the bottom of the camera, click the right arrow, and click Share. And then maximize the screen or enlarge the screen. And now the provider has full view of the camera. The lens on this camera is the general viewing lens. Also in your cart is the dermatology lens as well as the otoscope lens for ear, nose, and throat appointments. These are located in the bottom drawer of your cart. And then when you're done with using the handheld camera, exit out of the viewing screen and turn off the camera by pressing the power button on the top of the camera. Unplug and put the camera back in the charging cradle. Occasionally, you will have to change the batteries on the stethoscope. To change the batteries, you twist the black cord off of the head of the stethoscope like so. The battery comes out easily. It's a AA battery. And you put it back in and connect the cord back, and that's how you change the battery. Now you know how to operate the stethoscope as well as the handheld camera. We are now going to have a patient and provider interaction and have the distant provider call the telehealth cart. Before the distant provider calls the cart, it is important to remember to have the stethoscope and its application up and running, as well as the handheld camera and its application up and running. Before every appointment, there is an arrival process that dictates what the provider's staff would like for you to do before calling the provider. This arrival process is in the document library. The doctor is now going to call the cart. As you can see, the cart automatically answers, but answers on mute. Unmute by pressing the unmute button on your silver remote. Hello, Dr. Wilson.
Good morning. Hey, Fern.
Hi, Dr. Wilson.
How are you?
Doing well. Thanks.
Great. I have looked at your vital signs. They all look good, and the labs that I have available to me, they look pretty good as well. I'll take a peek at the others when I get those results. Are you just here for your general checkup, your refills today?
And then I have a little spot I want you to look at.
Okay, that'll be fine. We'll start with listen to your heart and your lungs, and then I'll look at the spot.
Okay.
We'll go from there.
Okay, we have the stethoscope application open and the stethoscope on. So Dr. Wilson has instructed me to listen to the breath sounds.
Okay, that sounds really good. Let me listen to your heart. Okay. Now let me take a peek at the area you are concerned about.
Okay, we have our camera on and our application open. We will now direct the camera towards the spot. And we will share what we're seeing with Dr. Wilson by taking the silver remote and pressing the share icon that's selected. Pressing it again, and now it's shared with the provider.
Okay, I see it pretty well. Does it cause you any pain? Does it come about in any certain activities?
No, I just get spots. They come up. They last for a few weeks. They go away. They're never raised. They don't cause any problem. I just don't know why I keep getting spots.
Okay, I'm not real concerned about these, but I will be glad to send you to a dermatologist, as he would be better at telling you what's going on with you. Is that all that you have for us today?
Except for my refills.
Okay, We'll get those refills done for you. We'll see you back in 6 months. If you need us before then, do not hesitate to call us.
Okay, thank you.
All right, it's good to see you, Fern.
Thanks, Dr. Wilson.
Bye-bye.
Bye. The provider will now end the call, and we will exit out of the programs and turn off the camera as well as the stethoscope. That is the end of a patient-provider interaction. Now that we have finished the patient-provider interaction and the appointment is over, it is time to complete the patient survey and the telehealth log. To complete the patient survey, come to the computer and go to the top monitor and double-click on the icon labeled Telehealth Patient Survey. The survey immediately pulls up with a list of questions. The survey is 2 pages, and we encourage the patient to complete the survey themselves while they are in the clinic room and to come to the computer and complete the questions. The survey is 2 pages. The patient will click Save and Continue, finish the second page, and then click Submit. The survey is also in paper form in the document library, and if necessary, the survey can be printed and mailed to Cassandra Glover. Her information is on the screen. The second item to complete after using the cart is the telehealth log. Please complete it as described on the form. It is important to complete the telehealth log after each visit because the county health departments are reimbursed for each encounter. The telehealth log can be found in the document library. We are now going to learn how to make a video conferencing call using the telehealth cart. Take your silver remote and point it towards the lower monitor and press the call icon selected. Then you will see a directory. Use the up arrow and right arrow to get to the directory, and use the down arrow to scroll to see your designated location. Once you find your designated location, use the middle button to select, and then select again to make the call.
Hey Swapna, how are you today?
Hi April, I'm great. How are you?
I'm good.
It's good to see you.
Absolutely. Good to see you too.
I hope you have a great week, and I'll talk to you soon.
Yes, see you next week.
Thanks. Bye. And now we will end our call. And that is how you make a video conferencing call using your telehealth cart. Now it is time to learn how to turn off the telehealth cart. Come to the computer and take the mouse, and on the top monitor, look for the Start icon or the Windows icon. Click it and press Shut Down. The cart will take a few minutes to completely shut down. When shutting down, you are looking for the top monitor and the bottom monitor to completely shut off, and the fan that you hear to completely turn off. You will know the telehealth cart is off when you see the top monitor power button color turn to amber. You see the power button on the camera turn off. The bottom monitor is off, and the fan is no longer running. There are important things to note once the computer is off. Now that the fan has completely turned off, you can now turn off the telehealth cart by turning off the red button on the back of the power strip. The last step in turning off the cart is to make sure this black adapter is plugged into the nearest outlet. Now that you know how to use the telehealth cart, some things to remember. The document library has copies of all forms under the section Telehealth. Please use it. Make sure to read the arrival process for the distant provider you are working with, and read the designated protocol. Complete the telehealth log and the patient survey after every use of the telehealth cart. Adjust the camera angle for optimal viewing of the patient. Make sure they're in the center view. Start the stethoscope and camera programs before calling the distant provider. Make sure the cart and the patient are in an exam room for telemedicine visits. Patients can sit in a chair or on the exam table as preferred by the provider. If you have any trouble, please contact the Alabama Department of Public Health Office of Telehealth, Ron Davis, the IT Telehealth Specialist, or April Golson, the Office of Telehealth Program Manager. This concludes our training. Thank you to our volunteers for participating, and thank you for watching.